Hi, my name is Leslie Bursenbrugge, and this is a presentation about opioids and how an addict can have conditioned responses to their environment. The case study for this topic was interesting and a prime example of conditioning and drug use and how it can impact the body. The man in the study was used to a certain amount of heroin each day, and when he made a resolve to endure withdrawals, his body and mind were compelled to seek the drug anyway. Unfortunately, his tolerance appeared to be lowered due to the strange environment in which he injected the drug, leading to his death. This finding is most likely not common knowledge. People can become accustomed to using and not take environmental factors into account, especially if they are desperate for the substance to take effect. If explaining this phenomenon to a person in recovery, I would make sure that they understand the implications of this study and how it shows that addiction and tolerance levels are developed over time and do not simply rely on tolerance to the substance. Tolerance can be developed by sensory cues and environmental factors as well. As a harm reduction technique, if someone is not quite ready to stop using opioids, it might be helpful to encourage clients to use in a safe environment and make sure they are not alone. The topic of conditioned tolerance parallels discussions about triggers when considering drug use and cravings. Being in a certain environment produces stimuli that can prepare the body for an event or a feeling. For instance, the innate nature of conditioning can increase adrenaline and a heightened sense of awareness if someone is exposed to a fearful or perceived dangerous situation. Similarly, if repeated behavior, in this case injection of heroin, is performed in a consistent environment, the body and the brain anticipate the behavior before it is actually performed. This phenomenon is the same way that triggers and cues are formed. Our bodies recall a behavior from a certain cue, and if the anticipated behavior is not performed, we are left with a craving. For people in recovery for drug use, classical conditioning can be used to their advantage. Similar to learned negative behaviors, the body is able to unlearn or decrease association of a response over time. Habits and rituals that are formed during active use can be disassociated and lose intensity in recovery. As a counselor, I often encourage people to allow themselves to form new patterns and behaviors that are supportive to the recovery efforts. For instance, if a person continually calls a certain person with the intention of obtaining drugs as soon as they wake up in the morning, it would be important to develop a new pattern for their morning routine. Perhaps introducing meditation or exercise in the morning as a distraction from old habits. People who are suffering from opioid addiction often develop routines and patterns that can become as difficult to break as stopping the drug itself, let alone physical tolerance. The routines become entwined in addiction and behaviors are difficult to distinguish from the physical dependence. When people do something often enough, our brain becomes accustomed to the act. According to this case study, it can have serious implications for function in the form of tolerance. After reading this article, I was talking to my clinical director about this case. I explained the phenomenon to him and asked if he'd ever heard of anything like this. He said that he remembers when he was using. If he was experiencing physical withdrawals, just the thought of being able to obtain something would make him feel better, and they would create feelings of relief and ease his physical symptoms. He began to associate the phone ringing with the potential for available drugs, and would feel himself uplifted when the phone rang. For people who are trying to overcome opioids, which have proven to be highly addictive and dangerous, separating the associations from the drug will be an important piece of recovery. Recognizing patterns and changing routines in early recovery can help ease the powerful effect of cravings and triggers. After enough time and disassociation occurs, the conditioned response should lose its intensity, creating new associations or lack of connections. There's no easy way to ensure safety from overdose, aside from abstaining from the drug. Street drugs vary in content and quality, and other factors such as polysubstance use and tolerance can play a role in determining lethal levels of a drug. If someone is using, it is important that they understand condition tolerance and be aware of how environment plays a role. If someone is in recovery from opioids, they can use the same type of knowledge to look forward to alleviation from triggers and cravings. Educating and meeting the addict where they are in their addiction is an important part of the recovery process. Thanks for listening and have a good day. Thanks.